Are you caring for a loved one with dementia? You don't have to figure this out all on your own. Welcome to Truth, Lies, and Alzheimer's, the show that helps you reimagine a new relationship with your loved one, a relationship a little more free of stress and anxiety. Join host Lisa Skinner and her 30-plus years of experience as she guides you on a new path to a better relationship with those you care for. Here's Lisa.
Hi, everyone. Welcome to another episode of the Truth, Lies, and Alzheimer's Show. I'm Lisa Skinner, your host. And as we've talked about before, dementia affects many aspects of cognition, from memory and language to behavior and daily function. One lesser known but significant symptom is called agnosia. And this is the inability to recognize objects, people, sounds, or smells despite having those normal sensory functions intact. For families and caregivers, understanding the connection between agnosia and dementia is really essential. Agnosia not only disrupts daily life, but also influences perception, safety, and relationships. So today, we're exploring what agnosia is, how it appears in dementia, and strategies to support those who are living with it. So what is agnosia? This might be a brand new term that you've never heard of before. You may recognize it once I start talking about it, but you may not have heard that term. So agnosia is a neurological disorder where the brain cannot correctly interpret sensory input. And importantly, it is not due to loss of sight. It's not due to loss of hearing or touch. The senses are still intact. Instead, the brain struggles to make sense of the information it's receiving. There are different types of agnosia. There's visual agnosia, which is difficulty recognizing familiar objects or faces, even though a person's vision is normal. There's auditory agnosia, which is the inability to recognize common sounds, like a ringing phone or a dog barking. There's tactile agnosia, which is the inability to recognize objects by touch, despite that sensation still being intact. And there's prosopagnosia. Hope I'm saying that right. Also called face blindness. Most of us have heard of that, which is difficulty recognizing familiar faces, including our loved ones. And anosognosia, which is the lack of awareness of one's own condition, often present in dementia. So these types can appear separately or together, depending on the underlying cause. Dementia, especially Alzheimer's disease, causes damage to our brain regions responsible for memory, language, and perception. The occipital and temporal lobes are often involved in visual and auditory processing. When these regions are impaired, patients may see or hear, but fail to correctly interpret the information. Visual agnosia is common in Alzheimer's disease, where a patient may look at a toothbrush but not recognize its purpose any longer. Prosopagnosia appear in some types of dementia, and you'll see this when the person cannot recognize their family members, and of course that will lead to distress and confusion. And anosognosia is frequent in dementia, and you could recognize that because the person will inevitably deny that they have memory loss or insist that they don't need any help. The statistic on that is about 50% of people are not aware that they have a cognitive decline, and 50% of people are aware of it. So it definitely is going to have an impact on daily life. Agnosia complicates already challenging dementia symptoms because of the inability to recognize food, which may reduce eating, failure to recognize danger like a hot stove, which can obviously cause safety risks. Misrecognition of a loved one may cause anxiety for both the person living with it and for their family members and caregivers. So, signs of agnosia in dementia patients include frequently misidentifying familiar people or objects, appearing confused in familiar environments, difficulty following simple instructions when objects are involved, trouble recognizing sounds, or failing to respond appropriately. Neurologists and neuropsychologists diagnose agnosia through a couple different means: cognitive assessments, including memory, language, and recognition tasks, brain imaging, MRIs, and CT scans to identify damage, and they rule out for vision or hearing impairment. Because agnosia is often mistaken for memory loss alone, proper evaluation is important. Supporting someone with agnosia requires patience, adaptation, and practical strategies, which stands to reason. I'm going to give you some communication tips. Use clear verbal cues. Instead of pointing, name the object directly. That's a door. That's the door to the bathroom. Pair visual with verbal input. So what that means is hold up an object while describing its use. Try to avoid frustration. Sometimes that's not always easy. But if the person cannot recognize something, gently redirect them for the time being. Create a supportive environment by labeling objects and rooms with large, simple text. Use consistent organization. For example, their keys are always in the same place. Their phone is always in the same place. And it's helpful to reduce clutter to minimize their confusion. Misrecognition can be extremely distressing. If a loved one with dementia does not recognize you, it's not personal. Staying calm and offering reassurance helps reduce anxiety for both parties. I've had so many people over the decades tell me that it's so hurtful to them when a parent or a loved one doesn't recognize them. And it is hard to separate emotion from the logic that it is the disease. But if you can try to remind yourself of that when it happens, it won't hurt quite as much. Agnosia, perception, and mental health. Well, agnosia highlights how deeply dementia affects our perception. When familiar people and places are no longer recognized, people may feel disconnected or even fearful. And this can lead to anxiety about daily routines, depression due to loss of independence, frustration with communication barriers. Caregivers can also face emotional strain. Understanding that agnosia is a symptom, not a choice, can help reduce tension and promote empathy. There's no cure for agnosia, but supportive strategies improve quality of life. Therapists can help people strengthen recognition skills, adapt daily tasks, and build coping strategies. Reminder apps for labeling photos of family members are available now. Smart home devices that provide verbal cues are now available. And adaptive clothing and tools that simplify routines are now available to help us through our dementia journey. And very important, educating caregivers about agnosia reduces stress and improves communication. So training could include role-playing exercises, communication strategies, and environmental design. For caregivers, understanding agnosia is key to compassionate, effective dementia care. While the condition cannot be reversed, patience, structure, and supportive tools make daily life more manageable for both people living with it and for families and caregivers. Now, for caregivers managing agnosia and dementia, here are some examples of helpful tools that you can use on a daily basis. Photo albums are great with large labels, and they are available on Amazon. Talking clocks and reminder devices, flashcards for memory stimulation, adaptive household labels and signage kits are available. And these tools not only support recognition, but also promote safety and reduce caregiver burden. Agnosia and dementia are closely connected, reflecting how brain changes affect perception as well as memory. Agnosia occurs when the brain cannot interpret sensory input despite their senses still being intact. In dementia, it often appears as visual agnosia, prosopagnosia, or anosognosia. It impacts daily life, safety, relationships, and mental health. Some supportive strategies include form clear communication to adaptive tools, and this can definitely improve somebody's quality of life. And that's what I have for you today on the Truth, Lies, and Alzheimer's show. I'm Lisa Skinner, your host. I will be back next week with another new episode for everybody. And in the meantime, two things. Check out our brand new website. It's still called mindingdementia.com, but it's been completely redone. So go check that out. And if you're inclined to, you can sign up for our free weekly newsletter, which every week contains a tip, an update, information that may actually end up being very valuable for you in your daily journey through dementia. So stay safe, everybody. Try to be happy. And I will look forward to having you all back next week on the Truth, Lies, and Alzheimer's show. Take good care for now.
Thank you for listening to Truth, Lies, and Alzheimer's. We hope you found something in today's episode that helps. We understand that caring for a loved one with dementia can be the challenge of a lifetime, but you don't have to do it alone. If you're ready for exclusive access to even more great content and resources, head on over to Facebook and join Lisa's Minding Dementia support group. We're a community of like-minded caregivers, and we're here to help.